WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
What is behind the sudden international spread of monkeypox? The virus may be exploiting a change in population behavior and increased global travel, but it can still be stopped from spreading further. What started as one unusual case of monkeypox has now spread to several countries, with many cases having no link to Central or Western Africa, where the disease is endemic. The World Health Organization's WHO most recent estimates from May 21st, CMAP, indicate that there are around 100 cases in 12 non-endemic countries, though there could be around 300 confirmed or suspected cases in 16 non-endemic countries. The virus appears to have gotten lucky and has hit parts of the population where people have been in close contact with each other, and also travel internationally. Isolated cases of the disease have been seen in the past in the US, Singapore and UK, but there have usually been just 1 or 2 cases before the disease has burned out on its own. Scientists are puzzling over how a disease that is not easily transmitted has been able to spread to so many countries and between so many people. The virus appears to have gotten lucky, says Dr. Lee Hampton, medical epidemiologist at Gavi, and has hit parts of the population where people have been in close contact with each other and also travel internationally. The current outbreak in non-endemic countries suggests that sustained human-to-human transmission is quite feasible, so it suggests that ongoing human transmission could also be happening in Africa on a larger scale than generally thought. Another factor is that routine immunizations against smallpox stopped in the early 1970s in places like the US and UK, as smallpox vaccines can be 85% effective at preventing its related virus, monkeypox. Many people born after that time are not immune anymore. The good news, Hampton says, is that it is less transmissible than COVID-19 and it's not an airborne virus or one that can be aerosolized as COVID-19 can be, and in hospitalized patients. Just using standard precautions, mask, gown and gloves, is completely effective in preventing transmission. He points out that this doesn't mean it will die out on its own, though. As the spread of the virus indicates, we will need rapid and aggressive containment measures, including targeted vaccination with the smallpox vaccine to contain the clusters. Scientists are racing to find out more about monkeypox. Much of our knowledge about the disease comes from the 1970s and 1980s, and the world has changed greatly over the last few decades. This means that the epidemiology, our understanding of who gets sick and why, of the disease is likely to have changed too. Also, the virus has been studied in specific settings in West and Central Africa, and viruses don't necessarily behave the same in different contexts. Hampton explains that this current international outbreak is clearly behaving differently from previous ones. Monkeypox had previously spread via chains of transmission that were usually 2 or 3 people long, at most 7 people long, so many cases were due to zoonotic transmission from infected wild animals. Human-to-human transmission was not continuous. So guys, hopefully you have liked this informative video, and if you liked this video, subscribe our channel. And don't forget to press the bell icon.